I was thinking today, it reminds me somewhat of after 9/11, but just how everybody's life in that single event was changed forever. I'm doing a lot of reading about different things lately, and the shared human condition phrase comes to mind with all this. We're all going through this together and figure out how we can do it. Waste can impact our lives in ways I don't think we even know yet. So talking about it, maybe we can all help each other get through
As the world grinds to a halt in efforts to prevent the spread of the deadly coronavirus, my newspaper set out to discover how it's upending lives across the region. I wanted to find out how all of you were feeling and how you were coping. And I wanted to do it all without ever having to come into contact with you, as a way to help prevent the spread of the virus. Here's what I came up with: the COVID-Diaries. It's a series of interviews, all conducted over video chat, that take the temperature of a community in a time of dramatic upheaval.
So I'm hoping that this space can almost be like a diary. Just I can hear what it is you're going through right now, how you're feeling in this very moment. But first, I just sort of get to know you a bit. What's your story? Who is Thomas Shaw?
Yeah, I'm a retired Navy officer. Was in the Navy for 27 years, Navy captain. Grew up in Aurora, Colorado, suburb of Denver. Went to the University of Colorado, and then after that, joined the Navy. Was a service warfare officer. Had commanded a few different levels. That's kind of my personal bio. I'm not doing anything right now. I went to work for a little while after I retired with San Diego County, and then that just, I think, probably jumped into a job too soon. Should have taken some more time off. And then about a year after that is when my wife Lynn got diagnosed with early onset Alzheimer's. So kind of jumping all over the place. Hope not really going in any kind of order. Hope that's okay, but it just kind of as it comes to my mind.
Yeah, that's all right.
So I'll start with that story, because I think that story is kind of pertinent to what I think we want to talk about. So on October 1st, she went into residential memory care. So my life, I spend about 3 or 4 hours a day visiting her. That's my story for the last about 5 years.
So now you said that you never thought that this would affect your life. What are the ways that it is starting to affect your life right now, just even in the early stages here?
Well, I'm going through everything that everybody else is going through. If I wanted to buy toilet paper, I probably couldn't because there isn't any in the store. People, I haven't been too affected so far by events being canceled because I just haven't. That's not my life right now. Is going out a lot, but specific to Lynn's situation, some things, and even since we talked this morning, some things have changed. So she had a couple different people who visited her. One was a volunteer through Alzheimer San Diego, and one was someone who was her caregiver when she was here, that kept a personal relationship with her and would visit Lynn. So Alzheimer San Diego, great organization, but I understand why they canceled those kind of visits, because they don't want to make. They deal with the high risk population, older adults who may have underlying health conditions. So they canceled those visits. So that's one person who couldn't visit Lynn. And then today, some new visitor restrictions came out from the memory care facility, where they only want family members to come and not any other outside visitors, because that is the at-risk population.
Do you have any concern that there might be a time where you're not able to go visit?
Yes, I do, and I don't know if that's coming. It's nothing I can control. It's nothing I would argue, but it's a concern. It's more of a concern with me not seeing Lynn than with the visitors not seeing her, because I go every day. And if I don't, if I miss a day, she probably wouldn't notice, but I don't know, if I can't go for a week or a month, I don't know how that's going to play out, because she's really, she's really attached to me, I guess is one way. And she doesn't like being left alone, but even though she's in a facility that has 50 other people in it, she still feels alone there, because she's not aware of her surroundings. So she may think she's alone when there's people around her. So that's a concern, is if this draws out a long time and I can't visit her, then how's that going to affect her her emotional well-being. But I just don't know. I mean, it's one of those things, you don't know what you don't know, and I don't know how it would play out. I'd certainly miss Lynn, but I'm more concerned about her and how she would react to it, and not being able to understand why. And I think she may go to, well, he just doesn't love me anymore, and he's off and found somebody else. He doesn't visit me. That's probably, well, I don't know. That's one possible outcome, because she wouldn't understand he's not visiting you because of COVID-19, and we don't want to infect everybody, or that she could not understand that. So she's still there. There's still a little, sparks or glimmers of who she was that's there, but it's been hard watching this independent, strong woman kind of shrink away in front of me. So I've heard it described as a long goodbye too, which is tough. So, which again, that's why I don't know how much time she has left. So, and since we're enjoying our time together, if I'm told I can't visit her, that's going to be tough.
Yeah. The last thing I'll ask you now, what was it like visiting her today?
It was good. I mean, she has good days and bad days like everybody else, and they're just completely unaware of COVID-19 or the stock market crashing, or anything that's really outside of about 2 or 3 feet around her. So as far as she was concerned, today was like every other day that we've spent together, because every day is kind of a new day. Her memory cycle is at best 24 hours long, or sometimes not even that long, but so every day is a new day. So I'll go tomorrow and we'll probably have the same day that we had today, which is fine. I mean, I have to live, she can't live in my world, so I have to live in her world. But we had a nice visit today, and I expect tomorrow's visit will be nice as well. So I just have to take it one day or one minute at a time when I'm with her.